My name's Kerry Leeson Beavers and I'm from Alström Syndrome UK. Alström Syndrome is an ultra-rare genetic condition and there are only 84 people diagnosed in the UK. Despite being rare, we have a very diverse patient population. The condition is extremely complex and progressive and can lead to severe visual impairment, hearing impairment, insulin resistance, diabetes, obesity, heart, liver, kidney-associated problems. Potentially, the condition can affect every organ in the body.
We were overjoyed when baby Sammy was born. Like all parents, we hoped things would be perfect, but early on we knew something wasn't right. Then he went into heart failure, but we didn't know that's what it was at the time. I'm not sure how we got through it. It was terrible. Slowly, though, he got a bit better and began putting on weight, until finally we took him home. But he just didn't seem well. He shied away from the light and seemed hungry and thirsty all the time. And what we thought was just a newborn thing, his eyes seemed to wobble, didn't go away. We knew he'd had a traumatic start, but our family and friends kept saying every parent worries about their babies. But we still had nagging doubts. We were back and forth to the doctors. Thankfully, at the hospital, the children's doctor finally suggested genetic testing. That's when we got a diagnosis of Alström syndrome. It was a shock at first. We had no idea what it was. The consultant hadn't even heard of it. She told us it's an ultra-rare genetic condition that can affect many organs in the body and what caused the heart failure. We were desperate to find out who'd passed it on. I felt so guilty, like it was my fault. But it's a recessive disorder, which means that both parents have to carry a copy of the gene to pass it on. So it's just down to chance whether two carriers come together to have a baby like Sammy. Getting the right tests and a diagnosis meant that we could find out more and get help. We got in touch with Alström Syndrome UK, who've been fantastic. They helped us get referred to an annual clinic in Birmingham, where an amazing team of experts help with all the different aspects of the condition.
We're very fortunate in the UK to have a highly specialised service funded by NHS England, and Alström Syndrome UK work in partnership with Birmingham Women and Children's Hospital and the Queen Elizabeth Hospital in Birmingham to deliver the Alström service. Alström Syndrome UK is a national charity and we support individuals and families affected by the condition, and we also support the professionals working with them. We're a patient-led organisation and we have members of our staff team and our trustee board who have lived experience of the condition. My own son has a diagnosis of Alström syndrome. We manage a very comprehensive database in the UK of all patients diagnosed with the condition, and we've just developed a global patient registry. Our hope is that this data gathered will give us a real global perspective of the condition and lead on to hopefully to further our knowledge and understanding and potentially lead to new treatments. In partnership with our clinicians in the UK, we've developed a medical handbook, and in collaboration with clinicians throughout Europe and beyond, we've developed some clinical management guidelines. We've always understood the importance of collaboration, not only within the Alström syndrome community on a global scale, but also more generally within rare diseases. For many years, we've worked in collaboration with organisations representing families affected by rare and genetic conditions. And we've been involved in many different panels and committees. More specific to Alström syndrome, we do have some research ongoing in Edinburgh, and we're very fortunate now to have a mouse model, and they're looking at the role that fat tissue plays in things like diabetes and heart and liver problems associated with Alström syndrome. So we're really hopeful that together, along with the learning from the clinical teams, that will develop our knowledge of the condition and lead to future treatments. There is a great deal of unmet need within the Alström community. You know, to have a condition where there is no cure and there is no specific effective treatments is, as a parent, is extremely difficult. We know the complexity of drug development, particularly for such rare and complex conditions. What we want is the opportunity really to share our expertise as a patient organisation and to work with others in the hope that one day we can have a treatment that will really make a significant benefit to the lives of people that live with one of the most rare and complex conditions in the world.